Many of the clinics are running on generator power, which gives them limited capacity. I would say about half the clinics don't have running water. I think the biggest health challenges are several. One of them would be for patients who do have chronic diseases and keeping the lifestyle and access to medications to continue to treat those illnesses well. So that includes having your medications for your blood pressure or being able to refrigerate your insulin if you have diabetes. So there's a challenge for patients who already have chronic conditions which become harder to take care of in such austere environments. The other layer of health challenges I think that the population sees are acute illnesses, infectious illnesses that are directly or indirectly related to the hurricane, which are more difficult to care for when it's harder to get to the clinic, or when the clinic you're going to has limited hours and no power, or the pharmacy may not be well stocked. We are finalizing our longer term plan, which is to continue to work with a system of federally qualified health clinics and support them with generators and support for purchasing diesel fuel, building repairs, and staff support. The health workers here are doing a very admirable job. Somewhere between 5 and 15% of the employees of the clinics we're supporting have lost their homes fully, and so that's a particular challenge for those people. They're essentially working full-time or overtime, continuing to try and stand up their health systems and care for people. What surprised me the most is the extent of impact on the entire island. There really was not a single corner of the island that was not affected by the hurricane. I think that things are getting better overall. That said, I think we have to be cautious to monitor, because sometimes lacking services for a long time causes problems further on down the line, and we need to try and mitigate things getting worse in certain areas before they do. It's fairly easy to forget about an event 10 days, 2 weeks after it's occurred, because frequently it's the news coverage, the media falls off about the event. But events like this, especially that have caused so much damage and devastation, really take months, if not years, to recover from. And many of the organizations involved, including International Medical Corps, are here for many months and need the support and the funding and to respond adequately over many months.